It's changed it immensely. I think we live in the information age, and patients come to see you, they want answers right away. And for me in the past, I used to have to see patients, and if I ever ordered a CT scan, I would have to get authorization, send them across the street, and sometimes you have patients that come from far away. And so it would take sometimes weeks to get them back. We have to call them, so efficiency is the biggest thing. And it's just really changed everything we do at this point. As a foot and ankle surgeon, obviously we're dealing with 20-something joints, 30-something bones. So I think best indications for me. So we do a lot of fusion work, and so from a reconstructive standpoint, I can monitor the rates of what they're fusion, or when they're fusing, or when they're not. I can, from a trauma standpoint, I can get more detailed images in terms of what the fracture patterns are right away. And I can also get, from a research standpoint, being at the Injuries Institute, we do a lot of research here, and lots expected of you to obtain data and information. And so, from a research standpoint, I have access to my own CT scanner and get that information right away. From a diagnosis standpoint, I would say the biggest areas are syndesmotic injuries, and from Lisfranc injuries, having the ability to be the only weight-bearing CT scanner that I know of, I can get that information, which everything that I was trained on as a resident, essentially for me that information is essentially changing because I've got a CT scanner. Now we're acquiring data, and we'll publish that data based on the measurements we get, and it's going to change the way we treat syndesmosis injuries and Lisfranc injuries. I would say it's a must. I think it's the term's overused, but I think it's a game changer. I think for me it's changed my practice, and I think it'll be the standard of care for every orthopedic or even a podiatrist in practice. Any foot and ankle surgeon for that matter will need this machine. It'll be expected because I think the information we're obtaining from it is essential. Patients really enjoy it. I think they're surprised I can get that information so quickly after a scan. They're impressed by the fact that it's got hardly any radiation coming out of that machine. They can get back to their patient room in about a minute after a scan. I can pull it up on the screen. The 3D reconstruction is very valuable. They think that's very neat. It is pretty cool. And I explain it to them in detail, and they get an answer right away. And I think that it's extremely positive. Obviously for us, we have x-rays, ultrasounds, MRIs, and then the pedCAT. I would say my MRI usage has gone down since I have a CT scanner. I find the information much more valuable. I still use an ultrasound for soft tissue. Even then, so the ultrasounds are starting to replace MRI usage as well. So, and then I have my own x-ray. But I think it's definitely impacted my usage, and I find it almost a necessity, if you will.